Hello, my name is Tori Nakua. I am a nurse practitioner student, and today I will be performing a cranial nerve examination. Is that okay with you?
Yes.
Can you provide me with your name?
Jason Nakua.
Okay, and if at any time, if you have any pain or tenderness, please let me know and we can pause. Okay, I'm going to perform hand hygiene. And we're going to start with cranial nerve 1, the olfactory nerve. This is for your sense of smell. And first, we're going to check your patency of your nostrils. And by doing this, you're going to plug each one separately. So let's start with your left. And take a deep breath in and out. A little bit of blockage there, but still patent and good airflow. And let's cover your right eye side. Breathe in and out. Great airflow, patent. And we're going to, the next part, we're going to check the sense of smell. So what I'm going to have you do is close your eyes and plug your left nostril again. And I'm going to provide you with the scent of smell, and you let me know what it is. One second. Okay, you can smell.
Eucalyptus.
Excellent. And then you can plug your right side. Okay, you smell?
Coffee.
Okay. His cranial nerve 1 is intact. He was able to, you can open your eyes and is intact, and he was able to identify both scents. We'll be moving on to cranial nerve 2, the optic nerve, which is also a sensory nerve, and this is for vision. To start, do you have any corrective lenses, glasses, contacts?
No.
Okay. So we're going to start with this Salins chart, and I have it posted on the wall over here about 10 feet. It's 10 feet away from us. I have a card. So with this, I'm just need you to turn your body. Okay. You see the chart here?
Yes.
And cover your left eye. And can you read the smallest letters?
LEFODPCT.
Okay, correct. So that's 2020 on his right side. And then you're going to cover your right eye and read the smallest numbers that you can.
LEFODPCT.
Okay, you got all of them correct, and that's 2020 as well. Okay. Thank you. For the next test, we'll be doing the visual field using the confrontation test. Is that comfortable for you?
Yeah.
Okay. So you're going to cover your left eye. I'm going to do it with both eyes. And then you just let me know how many fingers I'm holding up.
2, 1, 3, 1.
Okay. And then can you cover your right eye?
2, 3, 1, 4.
Okay, thank you. That's good. He was able to correctly identify all of them. His visual fields are intact. No defects found during the vision test. And then we're going to be doing the fundoscopic examination using the ophthalmoscope. For this one, I can get a little uncomfortable because I can be fairly close to your face. So, okay. And I'm going to be shining a bright light into your eye. If you could just fix your eyes on the big letter on the Shelley's chart. Okay. The red reflex was present and intact. Check your. Just cover my eye. Okay. Thank you. The red reflex was also present and visible in his left eye. Both bilateral optic nerves were clear, round, pink, creamy pinkish, and they had a macula was slightly dark. No. margins were sharp. And then the disc ratio was less than half, and no swelling or increased cupping noted. His retinal background was red-orangish in color, and the macula was slightly dark. Vessels, his arteries were bright red. The veins were purplish color, and then the veins were slightly larger than the arteries. And I did not see any exudate or visual hemorrhages. Okay, that completes cranial nerve 2. We're going to move on to cranial nerves 3, 4, and 6. These are all motor nerves that operate the muscles of the eye movements. Cranial nerve 3 is the ocular motor nerve that is responsible for the pupillary restriction and raises the eyelids with the levator muscles. It also is responsible for the movement of the medial, superior, and inferior rectus. Medial, superior, inferior rectus, and the inferior oblique muscle. And then cranial nerve 4 is the tracheal nerve, and that's responsible for the movement of the superior oblique muscles. Then you have cranial nerve 6, which is the abductions nerve, and it is responsible for the movement of the lateral rectus muscles. First, we're going to check for pupillary response, direct and consensuals. So this is a bright light. I'm going to shine it into your eyes a few times, okay? Just look straight ahead. So it's a brisk pupillary response at direct, and then consensual is responsive as well. So then I'm going to check your left eye. Sorry. A direct brisk response. And then consensual is also intact. His pupillary size is a 5, about a 5, right? 5 millimeters right now. And then we'll be doing the accommodation test. So if you could just look straight at that E and look at my finger. Okay, accommodation is intact. So patient does have perla. Pupillaries are equal, round, reactive to light, and accommodation is intact. The next eye test that we'll be doing is extraocular eye movement of the 6 cardinal fields. Okay, so you're just going to follow my finger, okay? So I'm going to start. So the eye movement was smooth and full. No deviations noted or abnormalities. No nystagmus or paralysis of his eye muscles either. Next we'll do the corneal light reflex. So what this one is you're going to have your eyes fixed onto the chart again, and I'm going to shine the light in the middle of your nose bridge and check for the light response. Okay, so the light was symmetrical in bilateral eyes using the corneal light reflex. The next test we're going to do is the cover-uncover test, and this one checks for misalignment, any deviations, or bigness. Okay, so if you could, I'll cover it for you. So keep your eyes fixed. Please do not move them. His eyes remained aligned bilateral and stayed fixed on the paper. And no deviation was noted either. Next, we're doing the cranial nerve 5, the trigeminal nerve. This is both sensory and motor nerve functions. We're going to be testing his lateral jaw movement. I'm going to put my hands here, and you're just going to move your jaw like this to check for the movement. Okay, good. It was good movement, no limitations, noted. And then I'm going to have you grit your teeth as well. Okay, strong jaw. And then we're going to test the sensory portion of the trigeminal nerve. So I have a sharp and a dull object here. And I'm going to check your eyebrows, your cheeks, and your chin with your eyes closed. You let me know if it's sharp or dull. Okay?
Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull.
Okay. Then you can open up your eyes. Thank you. So he had a good response to sensation. He was able to identify both sharp and dull. His cranial nerve 5 is intact. We'll be moving on to cranial nerve 7. This is the facial nerve and also has both motor and sensory functions. With the sensory function, it does test the tongue, the 2/3 anterior portion for taste. We will not be testing that today, but we will be testing the motor section, and that's facial movement. So I'm just going to give you some commands to do different facial expressions. If you can just follow those for me. Raise your eyebrows, please. You can lower. Grr. Smile. And blow out your mouth. Okay. His facial movements were all symmetrical bilaterally, and no abnormalities found. We'll move on to cranial nerve 8. That is acoustic nerve, and this is a sensory nerve for hearing. So we'll have 3 tests for this. We'll start with the whisper test. Okay. So what I'm going to do is I'm going to stand behind you, and you're going to cover the opposite ear of the side that I'm on. And I'm going to whisper 3 words after I repeat, and then after I'm done, repeat the words, okay?
Okay.
So you cover your left ear.
Excited green January.
Okay, excellent. And then cover your right ear, please.
Excited green January.
Okay. Awesome. That was a normal whispers test. He was able to identify all 3 words. Then we have the Weber's test. So I'm going to use my tuning fork, and I'm going to place it in the center of your head, and you're going to let me know if you hear it in one ear or the other, or if it's equal. And this is testing for hearing conduction in the ears. Okay, ready?
Equal.
Okay, so that is a normal Weber's test to hear equally. No lateralization noted. And then the last hearing test that we'll be doing is the Renan's test. So what this one is I'm going to time it. Okay. I'm going to do the same thing. I'm going to put the tuning fork on the mastoid process. You're going to let me know when you no longer hear it. And then I'm going to move it to the front of your ear, and you're going to let me know when you no longer hear that. Okay?
Okay.
So this is bone conduction, air conduction. Okay.
Okay. Okay.
Nice. Okay, so that air conduction and bone conduction, it was a 2-to-1 ratio, so that is a normal finding. We'll check the left ear.
Okay. Okay.
Okay. That was also a 2-to-1 ratio for the air conduction to the bone conduction, so that's a normal finding on the bilateral right and left ear. Okay, so that completes our cranial 8 acoustic nerve test. Then we'll be moving on to cranial nerve 9, glossopharyngeal, and also cranial nerve 10, the vagus nerve, which are both motor and sensory nerves. For cranial 9, it's the taste of the posterior 1/3 tongue and throat. And we will not be testing that today, but we will be testing the muscles of the larynx and pharynx from swallowing for those muscles. Okay, so this one, I'm going to have you stick out your tongue and say, I'm going to check your uvula in the back. Come towards me. Sorry, I can't see you very well. Okay. His uvula raises and falls symmetrically. It is midline, no deviation noted. I'm going to check for gag reflex. Gag reflex is intact. And then the last one is, can I just have you swallow for me? And he's able to swallow, so cranial nerves 9 and 10 are both intact. We'll be moving on to cranial nerve 11, the spinal accessory nerve, which is the motor nerve responsible for the trapezius and sternocleidomastoid muscles. So for this one, I'm going to have you shrug your shoulders, and I'm going to push, and you're trying to hold it against resistance, okay? Okay, shrug. Okay. He's able to hold resistance against my pushing of the shoulders. And then next, I'm going to push against your face and try to resist. And then resist. He has a strong resistance as well on the face. So that will be cranial nerve 11 is intact as well with full resistance. Lastly, we have cranial nerve 12, the hypoglossal nerve. This is a motor nerve for the movement of the tongue. So for this one, I just need you to stick out your tongue. Okay. It is midline, no deviation, no tremors noted. You can put it back in. And I'm going to have you push your tongue from side to side and your cheeks. Okay. And there's strong that is present. And lastly, can I just have you say light, tight, dynamite?
Light, tight, dynamite.
Okay, that is all intact. So cranial nerve 12 is intact. And this completes my cranial nerve examination. Thank you.